Last year, 2 years after a kidney operation to remove a blockage, Jim noticed he was once again having problems with his kidney. He came into the emergency room at Langley Memorial Hospital in extreme pain and was seen by Dr. Perks. After assessing the situation and consulting with Jim, Dr. Perks decided the best approach was to proceed to surgery. Within 2 days, Jim was in the operating room undergoing a procedure to remove the blockage from his prostate.
Before surgery, when I examined it, I was worried about it being cancerous. I did the laser resection, and at the very end I did some biopsies to help confirm whether or not there was prostate cancer there or not.
While the operation was successful and Jim was able to void again, the results of the biopsy revealed what Dr. Perks had suspected all along.
Unfortunately, when the pathology came back, it was a very high grade and aggressive prostate cancer.
Dr. Perks called me in and basically said, "I'm very sorry, but I have to tell you that you have prostate cancer and it's stage 3. It's very aggressive, and we need to do some tests because it could be in your bones, it could be in your lymph nodes and everything." And I think she kind of was expecting it to be there. Like, it really hit me, and I had to sort of decide, do I literally say no thanks, no treatment, and I just basically finish the bucket list I haven't done yet? But I'm one of these few people that's done a lot of the bucket list, and I still enjoy life. So I thought, let's give this our best shot. So we went ahead and did the tests.
Once we determined that it looked like this aggressive cancer was localized to the prostate, we just discussed options for management.
We decided to do a combination of the hormone therapy and radiation.
Within weeks, we started the hormone ablation.
And we keep a really close eye on it, and I'm doing well.
Dr. Perks discovered the cancer with a biopsy during the treatment for prostate blockage. Her quick action in taking that biopsy was an extra step in Jim's care, and may well have saved his life.
She didn't have to go that extra mile, which is very good that she did that.
This is something that we hope never to miss in somebody. He came in with a problem that was related to his cancer, and so it was part of that diagnosis. So I think it was just part of the process of finding out what was happening to Jim and then addressing it the best we can at that moment.
She is an amazing physician. She's so dedicated to her patients. It's pretty impressive.
Advances in technology allowed Dr. Perks to conduct Jim's surgery with a non-invasive telescope system with the support of a video tower.
Surgical techniques are evolving every day. We're able to do things for patients that used to keep them in hospital for days or even weeks at a time that allow them now to leave hospital a day or two after their surgery, sometimes even the same day. Those sorts of equipment are called minimally invasive surgical equipment. They're cameras, they're other instruments that allow us to work on someone without having to disturb their normal tissues any more than absolutely necessary. So it means we focus on curing the disease without causing any unintended injury. So patients get better more quickly and leave hospital and get back to their normal lives sooner. Those are the sorts of equipment that are unfortunately expensive and are rapidly evolving. Cancer remains a very high cause for mortality and morbidity in our population, particularly in the aging segment of the population. If we can detect these cancers early, it'll absolutely make a huge difference to many people in our community, your friends, your neighbors, your family members.
Every time I've been in the hospital here, the treatment has been great. Dr. Perks has spared no effort. When I needed something, it just happened.
We're a community hospital. We see our patients in the grocery store, in the bank, in the lineups, wherever we go. And so we're very committed to ensuring we do the very best for all of our patients.
Your regional hospital serves everyone. When you donate, you're helping everyone in your community.
So in order to provide our patients with the best possible care, we need to keep pace with those advances in technology so that we know that any patient coming here is getting care that would be as good, if not better, than they would get anywhere else. Thank you so much for your support in allowing us to acquire the most critically required equipment so that every patient who walks through our doors gets the best care possible.
Please support our work with a donation today.
Thank you for your donations.